here's your cervical thoracic acute phase flexibility exercises. So I'm going to start with our cervical. Range of motion here on the wedge, so their head is a little bit forward. This will be your neutral to flexion bias. Doing your flexions here, your extensions here, rotations, and side bends. If you're going for prone, for lumbar, cervical extension bias, you have to do them in prone. Which would simply look like a propped on elbows position. Flexion, extension, and your rotations here, and your side bends here. Next is double knee to chest, active range of motion. We do a little bit of these to get some thoracic flexion as you pull. A little range of motion in the spine. Open book. So you're gonna have them this way. You're gonna have their arms straight, about 90 degrees, bottom leg straight, top knee stays on the table, and then they twist. You can do this without the cervical spine, keep the cervical spine relaxed. You can add some active range of motion of the cervical spine. Then you could use it with a roll, sometimes I have a hold the baseball or a softball, and they'll roll that arm up as they reach back, and roll their arm and reach forward, suck it in and reach back, so you get a little scapular motion in there as well. A little scapular retraction, protraction, as well as the thoracic rotation. Next one is thread the needle. You can do this multiple ways, such as a quadruped here, where you're gonna reach and then reach up, reach up. We can do this from like an incline, so they'll be here, reach here, and then reach up, so they get a little bit more of their pelvic and lumbar movement at the same time in a standing position. The barrel stretch is a thoracic flexion. You're gonna hold here, increase the size of the barrel, decrease the size of the barrel, increase the size of the barrel, decrease the size of the barrel. This is the opposite of what we want for those patients, just doing scapular protraction, retraction. We want protraction with that thoracic flexion, retraction with the thoracic extension. Thoracic extension on the foam roller in the chair. Come over this way. That way you can see thoracic extensions in the chair. So we want to make sure that they are set up in the same position with the back against something. This exercise here, and they lean all the way back. They may buck all the way back, that they go out of tipping back. So they're gonna have their arms here. If for whatever reason they have a shoulder issue, you can have them here or here is fine. You'll get a little bit more out of it here. So push their butt all the way back in the chair. Try to arch around the foam roller. Then they could go do however many you want at each level. Each time they lift, scooting their butt back a little bit more, keeping the foam roller level. Deep breath in on their way back, breathe out on the way forward. Deep breath in with thoracic extension, breathe out on the way forward. If they're like me and they don't have a thoracic spine that's too restricted to get a stretch in that position, they're gonna need to go to the floor and get gravity involved. We're gonna do it here, same thing, butt stays down, deep breath in, breathe out. Deep breath in, breathe out. And they can just walk their way up and down the spine. They can also roll here and again try to hinge over the foam roller.